Imagine checking your blood pressure and suddenly seeing 180, 120 on the screen. Should you panic? Should you ignore it? Go straight to the hospital or call 999. In this video, I'll explain exactly when high blood pressure becomes an emergency. High blood pressure is often called the silent killer, and the reason for this is simple. Many people feel completely normal, even when their blood pressure is dangerously high. But when blood pressure rises extremely high, it can suddenly damage important organs like the brain, the heart, the kidneys, and the eyes. That's why knowing when blood pressure becomes an emergency can literally save lives. Let's first understand what normal blood pressure looks like. In general, anything around 120/80 is considered normal. 140/90 or higher is considered high blood pressure when taken in clinic. And 135/85 is considered as high blood pressure when taken at home. But an emergency is not defined by these numbers. Blood pressure becomes a hypertensive crisis if it reaches 180/120 or higher. Because at this level, your blood vessels are under extreme pressure and complications can occur quickly. So, if your blood pressure is 180/120 or higher, the next thing that matters is symptoms. Warning symptoms here would include severe headache, chest pain, shortness of breath, blurred vision, confusion, weakness, or difficulty speaking. If the symptoms occur with extremely high blood pressure, this may be a hypertensive emergency. In that situation, you should seek urgent medical attention immediately by calling 999 if you are in the UK. Sometimes people see a very high reading, like 180/120, but they feel perfectly fine. If that happens, the first step is not to panic. Instead, sit quietly for about 5 minutes, relax, and repeat the measurements. Make sure your feet are flat on the floor, your arms are supported, and you are not talking while taking the measurements. If the reading remains extremely high, you should still seek urgent medical advice immediately by calling your GP immediately if you are able to, or 111, or attending the nearest A&E to you. Blood pressure readings can sometimes be falsely high because of simple mistakes. For example, measuring immediately after taking a walk, talking during the measurements, crossing your legs, or using the wrong cuff size. These small factors can increase the reading temporarily. That's why repeating measurements correctly and calmly is very important. Extremely high blood pressure can damage organs very quickly. It can increase the risk of a stroke, a heart attack, kidney failure, and vision problems. The earlier high blood pressure is recognized and treated, the better the outcome for you. The key message here is simple. If your blood pressure ever reaches 180/120, do not ignore it, especially if you do have symptoms. So I'm curious, what is the highest blood pressure you've ever seen? Let me know in the comments below.